To understand how we got into this mess, where there are so many vested interests that even though a vast majority of the American public know the system is messed up and there is a lot of political will to change it, change doesn't get done. I think you have to look at the history of how we got here. And it really starts fairly recently in the grand scheme of things. In the 1920s. What's that? I put it up there like this.
Thank you.
All right. Starts in the 1920s when, for all of a sudden, the American medical industry now had tremendous expenses. There were innovations in technology. Prior to that time, you had your local doctor, you went to him, you called upon him, you worked out a deal on payment. There really wasn't any need for health insurance. In fact, health insurance did not exist prior to 1929. And it was in 1929 that you had the emergence of the first co-op health insurance corporation down in Texas, when a bunch of teachers got together with Baylor Medical School to form an organization where everybody would chip in, and then they would be able to use the services of the doctors who belonged to that organization. This is what we commonly now call an HMO. Back then it was a healthcare cooperative. And it took off from there. During the Great Depression, a lot of doctors who suddenly now had patients who could not pay the bills started joining up and starting cooperatives all around the United States of America. And the key part of this is that they were all non-profit. At the time, insurance companies, fire insurance companies, flood insurance, etc., did not want to touch healthcare. There wasn't any money in it. This was all done non-profit. And a lot of people started getting coverage all throughout the 1930s. Now, at the same time, FDR was, of course, dealing with the Depression, and there was a push within his administration to create a national health care system. But it wasn't until 1939, after they had pushed through Social Security and gotten the country going again economically, that they began to focus on that effort. But 39, as you all know, the start of the Second World War. Pretty soon, there really wasn't the political capital and the motivation to actually handle healthcare in the middle of a major national security crisis. So the Second World War happens. Now here's where it gets really tricky. The United States government wanted to control inflation. So they put restrictions on wages. Even if a company wanted to pay their workers more, they couldn't, because they would then kind of have to pay extra in tax purposes. It's a complicated story. But the government did not restrict health care benefits coming from the employer. So employers who wanted to attract employees without having to cross the federal government and pay extra taxes could offer their employees not extra money, but extra health care benefits. So now this doesn't, again, it's always such a bad thing. And that's the kind of crazy thing about this story. Every step of the way, you have good people making decisions which turn out for the worse, and this was one of them. So what you have now is more and more employers during the Second World War trying to attract better employees, employees being happy because now their employers are taking over this expense, and more people are being taken care of by their employers. After the Second World War is over, Harry Truman comes up with the idea of national health insurance. It was something that had started in Great Britain that same year, 1945, and he thought we need to bring this to the United States. But his main idea was that in order to make it happen, in order to have a single-payer system, you needed more doctors. You needed for the federal government to actually get into the business of building training hospitals and churning out more and more doctors. Now, who had a problem with that? Who always has a problem with making more doctors? AMA, the American Medical Association. Now, the AMA was started back in the 19th century for good purposes. They wanted to professionalize and standardize doctor training and the way doctors, were administering their medical. There were a lot of quacks running around. So the AMA has this organization, and they actually did a lot of good in terms of improving healthcare. But by the middle of the 20th century, the AMA had become a very powerful political and economic force, because now they're saying, wait a minute, more doctors that are out there, the fewer of, or that puts less of a premium on medical care, and now we're not going to be able to charge the high prices we've been charging. So the AMA winds up coming out against what they label socialized medicine, and they start to bash this program. Now, at the same time, the Republicans, who had been out of power for 13 years, since 1932-33, sees this as an opportunity to get back into power and this is not a coincidence, to start playing the anti-communist card against the Democrats, to connect the idea of reforming health care